Hi, I'm Steve Adubato. Welcome to a very compelling program looking at a whole range of issues that matter most. And we kick off with Michele Acito, who's Executive Vice President, Chief Nursing Officer at Holy Name Medical Center. Michele, good to see you.
Thank you, Steve. Good to see you.
Michele, we're taping on the 20th of May, be seen later. Put in perspective for us, what has the experience been like for nurses, most nurses, at this point dealing with the pandemic?
You know, Steve, what we faced as nurses is something we've never faced before and hope never to face again. What we saw come into the hospital last year was overwhelming, unbelievable, and, very scary. It was scary because everyone came to work knowing that they had to take care of these patients, sacrificing everything they had at home, because at the end of the day, they had to go home. And that fear of, am I bringing the virus home? Will my family get sick? Will I get sick? It was something that was daunting, but something we were driven to do, and the adrenaline kept us coming back. We knew that families couldn't visit, so we had to be not only the caregiver, but the family member. That was very difficult at times because it meant helping families say goodbye to their family member, knowing that they couldn't be there, so we had to be that connection. It was a very, very difficult time. And, for patients who were sitting in the hospital with no visitors, doors shut to provide negative pressure in the room, with only a television in front of them where they watched coronavirus and the death toll taking place, they had to be thinking to themselves, am I going to be one of those numbers? And so, the additional comfort that the nurses were able to provide really became so important to them. It became their connection to the outside. When you talk about what is different from last year to today we have a 2% positivity rate at our testing center. And remember, these people are really coming because they've either been exposed or they're not feeling well. It's not just the general population. So to have it at 2% makes us feel very good. 1 year ago today, our positivity rate was at 41%. So we've come a very long way with that.
Michele, let me ask you this. And by the way, Holy Name is one of the healthcare systems supporting our healthcare programming. Michele, let me ask you this. The long-term impact on the nursing profession moving forward later into 2021 and 2022 and beyond. Meaning, are there more people, fewer people? Who's signing up to be a nurse? Who's not? What impact has this had?
This has had a significant impact. I mean, I don't want to let you think otherwise, but everyone was mentally impacted by this. But because we came together and we were strong together and we got through it together, what we saw from the community was a 100% increase in the application rate to our School of Nursing. 100%. That meant that people saw in the community the impact nurses have on patients, the impact that we can have on care, and they want to be part of the solution. That was very encouraging for all of us, because your initial fear is nobody's going to want to do this. They've seen what we've gone through. They've seen the risks we've taken. And yet we saw the exact opposite. The community has overwhelmingly decided that they want to be part of the solution. And to have that kind of increase in the application rate made us feel very encouraged by what's going on in the world today.
Let me ask you this, Michele. I'm a student of leadership, as you know. Your CEO, Mike Marin, and I talk about leadership all the time, online, offline. Nurses as leaders, particularly in this crisis, describe it.
We really had to be at the forefront of trying anything new that could work. And our leadership in guiding the other members of the community here in our own hospital, whether it was any discipline, and working with them and showing them how we can get through this together and reminding them that we're stronger. Nurses went into this profession knowing we were going to be at the bedside and at risk. But you look at the number of employees who joined an organization for a job in either food service or housekeeping or transport, they really didn't sign up for this. So as leaders, we helped to guide them. We followed their lead, but they followed our lead to not be afraid, to use the protection that we were giving them, and to, really follow us, work with us so that we could, as a team, get through this together.
Final question. 2021, was it the year of the nurse team? Is it 2020? I can't even.
2020.
2020. Why is it not 2021, 2022, 2020? I don't get that part.
Well, Nurses Day is celebrated every year in May. And last year, before the pandemic even hit, it was deemed Year of the Nurse. So somebody knew something that we didn't, and it made all of us feel very
Oh,
proud.
that was before.
Yes, yes.
Well, I don't know what year is not the year of the nurse. And so, big picture, before I let you go, more professionals committed to going into the field of nursing than pre-pandemic, in spite of all these extraordinary challenges. And not just at your hospital, but at hospitals and healthcare systems across the nation.
That's correct. That's correct. People really saw what impact they could have, how they could help, how they could care for. Every day when they clapped and they cheered for us leaving, we realized that everybody appreciated it, but we didn't realize just to the extent. And that was driven by the number of applications. We saw how much they really respected that they wanted to join us in the fight.
Michele, from all of us who have family members who suffered with COVID, or people personally watching suffered and dealt with COVID, there is no way to say thank you enough to the nurses out there, physicians as well, but definitely our nurses. Michele, thank you so much for joining us.
Thank you, Steve. Have a great day.
You too. I'm Steve Adubato. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the New Jersey Education Association, Bank of America, Summit Health, Johnson & Johnson, MD Advantage Insurance Company, New Jersey Sharing Network, Fedway Associates, Inc., the Adler Aphasia Center, and by the Fidelco Group. Promotional support provided by NorthJersey.com and Local IQ, part of the USA Today network. And by bestofnj.com.
Hi, I'm Joe Roth. In New Jersey, there are nearly 4,000 residents in need of a life-saving organ transplant, and one person dies every 3 days waiting for this gift of life. One organ and tissue donor can save 8 lives and enhance the lives of over 75 people. You have the power to make a difference and give hope. For information or to become an organ and tissue donor, visit www.njsharingnetwork.org. And be sure to talk with your family and friends about this life-saving decision.